Assalamu alaikum. Good afternoon to one and all. Today in this video, I am going to take another unit from medical surgical nursing, that is emergency management in nursing. Okay, so what would be the emergency management of the critical situations, or we can say unexpected or serious illnesses? Okay, so that we are going to see in this unit. Okay, so before I start, I have a small request. Please watch this video till the end so that you can get all the points clearly understood. Okay, so without wasting time, let's start today's class. So when we are going to talk about the emergency management, first of all we must know that what is the definition, or we can say what is the meaning of emergency. Okay, so we can say a serious unexpected conditions or situations that needs immediate interventions or that needs immediate actions, so that's known as emergency. Okay, so we may be getting the emergency situations based on the type, like medical emergencies or surgical emergencies in the field of nursing, irrespective of irrespective of the place, time, understanding, because we won't be talking about the time or place, because it can be done anywhere. It could be any place, it could be in a roadside, it could be in the institution, it could be in the hospital, it could be in the home. Okay, so where are the nurses understanding, they see or they saw the patient is in critical situation, patient is in condition, and that may be life-threatening condition, so we need to take immediate interventions for them. So it can be of medical or it can be of surgical. Okay, so next one is about principles of emergency management. So what are the principles of emergency management? The first and foremost principle is establishing a patient airway, and we can also say ventilation and promoting the circulation. Okay, so which will be followed by the ABCD technique, that is airway, breathing, circulation, and disability. Okay, so means that if the triage, that is the triage is not working, I will tell you what is triage. If the triage is not working, understanding, if the technique is not working, then what you are going to do, you have to follow the CPR, you have to start the CPR. So now next principle is about triage. So what is triage? So triage is the process of classifying the patient's understanding based on according to the type and urgency of the condition, to get the right patient on the right time, on the right place at the right time, understanding with the good healthcare provider. Yeah, we can also say that triage, it is the process of prioritizing the treatment based on the severity of the illness or severity of the injury, because emergency conditions, they may be caused due to any injury, due to any illnesses, understanding that has been occurred, like hemorrhage, understanding internal external hemorrhage, some accidents, road traffic accidents, understanding drug poisoning, snake bite, canine injuries, blunt injuries, gunshot injuries. Okay, so that would be taken in consideration. So which condition would need highest level of care, that are highest priority, so we will give, so that is known as triage, understanding. Now next one is about the what is medical emergency and what is surgical emergency. So medical emergency can be defined as, we can say, when there is the sudden, unexpected and serious illness that requires emergency medical attention, that is known as medical emergencies, understanding. Okay, so next one is about the surgical emergency. What is surgical emergency? Surgical emergencies are the unexpected or serious illnesses or serious medical illnesses that requires only one alternative treatment, that is surgery. यानी वो medical emergencies वो medical illnesses होते हैं जिनको ठीक करने के लिए सिर्फ क्या होता चाहिए, surgical treatment. For example, intestinal obstruction, it is a chronic intestinal obstruction. And next one is acute appendicitis. If there is acute appendicitis and a person's chance of survival is there is only one method by which we can treat this condition, that is surgery, that is we can say this one, appendectomy, understanding. So that would be coming under the surgical emergencies, understanding. So next one is about, now let's talk about the medical emergencies. Okay, first we are going to talk about the medical emergencies. So first and foremost, let's discuss about the airway obstruction. So what is airway obstruction? The word obstruction का मतलब क्या होता है, blockage. So obstruction means only blockage. We can say that it is the blockage of respiration. So it's the blockage of respiration, means blockage of the air. Yeah, we can say it is the obstruction of the air, the blockage of the air, understanding. In the airways, it can be broadly classified into two based on the system, understanding, that is upper respiratory Second one is lower respiratory. Okay, so we can say that airway obstruction, it is a blockage of the respiration from the respiratory passages, and it can be classified into two types based on the system wise, that's upper and lower respiratory obstructions, yeah, airway obstructions. So now next one is about the causes. So what are the causes of respiratory obstructions? Okay, so first one is about severe respiratory illness, like for example we can say ARDS, acute respiratory distress syndrome, understanding, like we can say COVID-19, coronavirus, understand. So these are the serious medical conditions that requires emergency condition, because COVID-19, you might have seen that in COVID-19 when the patients were taken to the hospital, so they require immediate ventilation, they require immediate attention, so that is medical attention. And in the medical emergency we can also take this one, we can also keep COPD, understanding, chronic obstructive pulmonary disorder, we can also keep this one, we can say COVID-19. Okay, so these are some these are some causes which can develop as a result of airway obstructions. So next one is foreign body obstruction, like bacteria, virus, understanding any type of other pathogens. Next one is laryngeotracheal trauma. If there is any injury, if there is any blow to the trachea, understanding due to any surgery. Yeah, if there is previous history of surgery, and during the surgery you may get the trauma to the larynx as well as trachea. So next one is the penetrating laryngeotracheal trauma. For example, penetrating means that, for example, the patient has got gunshot, or we can say some blunt injuries, knife injuries. So that time also they can get, there is a problem with the larynx and trachea. Larynx and trachea will be there is the damage to the larynx and trachea, deep damage. Next one is tonsillar hypertrophy. So means that when there is the inflammatory condition of the tonsils, understanding, when there is a hypertrophy, means that there is the increased mass, understanding, increase the superficial mass on the this one, membrane or mucous membrane on the tonsils, understanding. So when there is the increase, understanding, that is known as hypertrophy, understanding. So next one is paralysis of vocal cords. If vocal cords are not working, if there is a paralysis, if there is the stoppage of functioning of the vocal cords, this may also lead to the airway obstruction. This may obstruct the airway, because when the muscles of, yeah, we can say, when the muscles of this vocal cords are not contracting or relaxing, understand, when they are getting stopped, so that time it can also cause obstruction, understanding. Next one is peritonsillar abscess. Understanding, so when there is the accumulation of the purulent, when there is the release of purulent discharge, that is pus only, yeah, when there is the formation of the pustules, understanding, the cells, so which will be taken the way in the respiratory passages. Now bacterial tracheitis, that is the bacteria which can cause inflammation of the trachea. Next one is the retropharyngeal abscess. Understanding, so it means that the pharynx, understanding, so when there is any injury to the pharynx, any disease connected to the pharynx, and there is the abscess, there is the pus discharge, a secretion from the what we can say as pharynx. Then laryngeotracheitis, there is inflammation of the larynx as well as trachea. Then asthma, chronic inflammatory disorder. Okay, then COPD, there is chronic obstructive pulmonary disorder of the alveoli, mainly affecting the alveoli. Okay, then there is emphysema, understanding, that is the collapse of the lungs. And then next one is the chronic bronchitis. So in this emphysema, when the lungs are unable to inflate properly, जब lungs अच्छे से inflate नहीं होता है, वही इसी को बोलते हैं emphysema. Then chronic bronchitis, there is the chronic, means that chronic inflammation of the bronchial, bronchial tubules, or bronchial airways. Next one, last one is the cystic fibrosis. Okay, that means that when the lung, like we can say cystic fibrosis, like we can say when the lung parenchyma is necrotized, damaged, understand, and then when there is the inflammation also, so because of that thing, when there is the accumulation of this when there is the inflammation, hypersecretion of this inflammatory mass, WBC and all other the exudates from that place, so they will contain, or they will be keeping the space of cavity, understand, so they can lead to the airway obstruction. So these are the etiology or causes of the airway obstruction. Okay, so now the next one is about signs and symptoms of this airway obstruction. So what could be the signs and symptoms? If we simply talk about the symptoms of this airway obstruction, we can say a patient may be getting the confusions, understanding agitations, understanding irritation, irritability, understanding then discomfortness, understand that there is also the chest pain will be also there, understanding that means panic attacks will also occur, understanding, and we can also difficulty in breathing, and patient will also be in need of much more air. He will be gasping the air, gasping of air will be there. Like he'll be continuously opening his mouth in order to get some airway, in order to get some oxygen so that he can survive. Okay. Next one would be like wheezing. Means that some whistling sound will be coming with the inhale and exhale breath. Okay. Then fainting means that unconsciousness. The patient may also fall. A patient may also get the fainting, or you can say he may also go to the unconsciousness. Okay. Then there will be also chronic dry coughing. Okay. So chronic dry coughing is also a symptom of airway obstruction. And also there is the feeling of something, sensation, something mass inside, something that is struggled inside the airway. Okay. That will be felt by the patient. Okay. Now, and also we can say a patient will also get choking. What is choking? Choking means when the patient will be in highest need of oxygen and he is not getting, and then patient will be understanding, so he will be he will be in much more need of and requirements of the oxygen. So when there is the need of the oxygen is not fulfilled, so he will be getting choking, that is severe difficulty in breathing. Understanding? So now next one is about the management. So what is the management of airway obstruction? So when the patient is getting choking, that means when he is unable to take a breath, there is a difficulty in breathing, there is the airway obstructions. So what is the management? The first and foremost is HEIMLICH maneuver. What is HEIMLICH maneuver? See, in this HEIMLICH maneuver, a person will be standing, understanding, a person will be standing just behind the person who is choking. Understanding? So, and after that what he is going to do, he has to wrap his both the hands, उसका जो दोनों हाथ है ना वो waist पर लेके आएगा. He is going to wrap the both hands on the this one waist. Okay. And after that what he is going to do, he is going to make a fist. Understanding? A person who is going to do the maneuver, this procedure is going to make the fist. And then after that he is going to keep behind the, or he is going to press up, keep behind the this one rib cage. The rib cage के नीचे रहेगा, ठीक है ना? So but it should not be it should be little bit elevated, थोड़ा सा ऊपर की तरह होना चाहिए, so that the procedure will be easily done, it will be possible. Okay. Then after that with the second hand, and what a person is going to do, means the healthcare provider, he is going to take his another hand, that is right hand, and then he is going to tightly grasp or tightly hold that another hand, understand, that fist hand. Okay. Then after that he has to make the upward and inward thrust like this. Okay, like this. Understanding? So this he has to the sharp upward and inward thrust should be done. So that means forceful, he will be pulling this fist up to the upwards, so that if there is any obstruction, that will be coming out. Understanding? And because of this thing also, the food particle may also coming through the mouth. So maybe because of that, with that only the obstruction will be relieved, that will be coming outside. Understanding? And this, the person has to do this for 5 times. That is known as that is known as thrust. Okay, so there is the thrust. He is to make the thrust for upward and inward thrust for the 5 times continuously. And if this thrust is not working, understanding, after the thrust only the patient is unable to come to the conscious state, or there is no recovery of the breathing, understanding, there is no promotion of the breathing, the airway, so then we have to go for the CPR. First we have to go for the give the epinephrine. So because epinephrine will be helping in relieving the obstruction, understanding, epinephrine will be activating the receptors in order to relieve the obstructions, understanding, in order to do the this one movement, muscle movements, that is a muscle movement, so that the obstruction may be relieved, understanding. So if this is not going to work, then you have to go for the CPR. You have to make the patient to lie on you have to give the proper position, and then you have to give the chest compressions, that is 100 to 120 chest compressions per minute, and with 2 mouth-to-mouth breathing in order to restore or recover the patient's breathing, understanding, and airway mammalian and circulation. Okay. Then if a patient requires emergency, patient requires surgery, then we can go for the first we can go for the endotracheal or we can say nasotracheal intubation, because when we are going to insert the tube through the nose or through the we can say through the trachea, so that if there is any obstruction we can remove the obstruction, or we can relieve the obstruction by the instrument, by the intubation, by the endotracheal tube and nasotracheal tube. And then we can go for the tracheostomy also, means that we are going to make the incision in the trachea. If there is any type of obstruction, that we are going to remove, aspirate, it, so that the patient will be promoting the airway. And then last one is cricothyrotomy. So what does mean? What does that mean? Means that where the thyroid gland is located, we can also check that if there is a hypertrophy of this voice box that I already told you, maybe the cause. So we are going to leave this one. We are going to do the surgery in order to correct the cause, correct the defect. So we are going to correct the defect in order to promote the near normal breathing. Understanding? So this was all about the emergency management of the airway obstruction. I hope you have understood about today's class. So with this, I am going to finish. Okay. So in the next class, let's discuss about some other conditions.